Welcome to another edition of Let's Talk Health. I'm Renee Nash. And this segment, again, is all about making sure that we bring you important, engaging, and powerful information so that we all can live our best lives. And so today we're actually going to be talking about mental health. There certainly oftentimes is a stigma, particularly in the Black and brown communities, when it goes to discussing the issue of mental health. So we're going to talk about why that is, what we can do to turn that around, and again, move forward to live our best life. So joining me today for that conversation is Dr. Erica Richards. She is Chair and Medical Director of the Department of Psychiatry and Behavioral Health here at Sibley Memorial Hospital. So thank you so much for joining us today for Let's Talk Health.
My pleasure. Thanks for having me.
So as I said in the opening, there is a stigma particularly in the Black and brown community, but I would dare say that it probably impacts everybody when we talk about mental health. Why is that, and what do we need to know about mental health?
So I think the reason that we see the stigma is because there just has not been an open conversation about mental health, especially not longitudinally, not something that has dated back historically. We're starting to talk about it more as a society, but in general, mental health was that thing we didn't talk about, the unmentioned reason why the aunt or uncle or cousin wasn't at the functions, or what happened. People do a lot of hand waving, but really can't talk intelligently about historical things that have happened with family members. Often, though, when we do open up and talk with friends or family, what we're hearing is that everyone has a story. Everyone has either a personal experience, a family member, or a friend that has received a mental health diagnosis. The more open and honest we are about that, then the more the conversation can continue, the more we can then receive information necessary to start treatment options, to have that discussion about diagnosis.
So how is it that we go about knowing that there is a mental health issue? Again, in many times, we don't even go to the doctor to check on our physical selves.
Right.
How do we get to the point where we're discussing the mental health component and then going to seek whatever that treatment needs to be, whether we're talking about depression, whether we're talking about bipolar issues and the like?
Right. So, of course, I think a lot of people, their first stop now is the internet. And so you always have to be careful with what you're reading and what you're exploring, but it is a good first place to start. Look at the criteria for depression. Look at the criteria for anxiety. Look at the criteria for bipolar disorder and understand, does that even sound like what's going on in my life right now? And if it is, then we encourage people to reach out to their care provider. Now, a lot of times people will say, I don't want to see a psychiatrist, I don't need a quote unquote shrink or that sort of thing. And so for a lot of times, psychiatrists who are medical doctors can be the initial stop, can be the people that make that diagnosis. But a lot of times it can be a family medicine practitioner. It can be an OBGYN for women that are struggling with depression or anxiety. And so there are many different avenues where we can seek the help. Some people will just say, I don't want to know, I'm not going to ask, or nothing's wrong. But unless you ask, unless you go through an open and honest discussion, and remembering that these discussions that you have with a healthcare provider are private, right. They're confidential. So you really do have to lay things on the table. But once you do that, then there's many times when we say, okay, this is normal grief. You just lost a loved one. You're going through a divorce. You lost your job. There are times when it's okay to be sad. And people have to understand that this will likely pass. But when it's prolonged, or when there's not necessarily an episode that has caused that, that's when we say, okay, let's have a discussion. How long has this been going on? Is it affecting sleep? Is it affecting appetite? We'll go through a list with patients to decide, is there a need for therapy? Is there a need for medication? Not everybody needs medication. What we know is that for those people that do need medication to treat their mental health condition, they will do better and get better much quicker once we get those medications right, and then possibly adding therapy to that.
One of the things that I've noticed more and more is that we are having high-profile people talk about their issue. I was reading a story just a few weeks ago about Taraji P. Henson, who indicated that she suffers from depression, and she felt like the pressure is even on her even more now as she gets more successful. Talk about, again, having persons like that come out and really help this kind of issue where it does take a little bit of that stigma off a person's everyday people,
Yes.
like you and me.
We need to hear it. We need to hear it from everyone. We need to hear these personal experiences. And when people do, I remember about a year ago now, Mariah Carey came forward and said that she had bipolar disorder as well. So like Taraji P. Henson, the important thing is, again, for us to start that dialogue and to understand. A lot of times when people come in, I say, listen, there's doctors, there's lawyers, there's politicians, there's teachers, there's many people that are affected. We would think about 25% of the population, between 1 in 4 and 1 in 6 people will be diagnosed with a mental health issue. And so that's a lot of people. In the Black community alone, we're talking about more than 8 million people that would meet criteria for a mental health diagnosis.
Are there any particular mental health issues that are really prevalent for us? I mean, so bipolar, depression, anxiety, the issue, I guess, kind of goes on and on, right?
We can. Those are the ones that people talk about the most. We talk about mood disorders or mood and anxiety disorders, which can be what we call major depression or unipolar depression, which is that major depressive episode. Bipolar, again, talking about people that can have both the ups and downs in terms of mood symptoms, anxiety. But there are specific phobias. There's people that can't get on elevators. There are people that can't get on planes.
That's me. I don't like to get on elevators.
Right. And so there needs to be a discussion about that. So for example, someone that can't get on the elevator to make it to a job interview, then we need to have a talk about that, or to get to work every day. Then that's where we talk about both medication and or therapies that will help you get on that elevator. That will help understand what the issue is, what the hesitation is, and talk about real and perceived dangers that might be limiting that. So it's something that's important that needs to be addressed, because again, there's reasons why, and we often ask, how much is it affecting your day to day, right? So if people are like, I'm okay, it's one level up, I can take the stairs every day, and it's not an issue, we might not need to go any further. But again, if it's floor, 60,
20.
right, then the stairs are not an option. And so there are other ways that we have to get people on the elevator if at all possible.
As a loved one, and you notice those kind of things with someone you care about, how do you approach them? Because again, there is a stigma. Most people don't want you that close in their space, and they certainly don't want you that close in their head space.
Right.
Yeah.
And so there are different ways that we can broach the subject. Telling someone, well, you're crazy or this or that is not quite the help that I think that they're seeking. But finding a discussion in a safe space to say, I noticed this, or I heard this on a talk or on the radio or on the television or on YouTube, then having a conversation about, are there similarities between what someone is experiencing, will be important. But that's also why, again, I encourage people to go to their healthcare provider, go to a therapist, go somewhere where you do consider it to be a safe space, where you might not want your family in your business. You might not feel comfortable saying everything. They might not know everything. And so really finding someone a lot of times that is outside of family to get that professional opinion is helpful. And then sharing what you're comfortable with family again, so that they understand moving forward. Is there a genetic component? There likely is a genetic component to mental health issues. We can't say for sure it's automatically passed down from one generation to the next. But we do think that if your family members, if your parents or grandparents have had depression or anxiety or those things, there are many reasons why we know that future generations may be more likely to experience that as well.
Let's talk about medications, because a lot of people I don't want to be put on a whole bunch of pills. There's a lot of fear to that versus if it's something that we can just talk through. Because everything you may not be able to talk through, you might need some help with medicine.
Right. And so we take everything on a case-by-case basis. And what we're saying is that, someone may come in, and I always try to draw this to other medical illnesses, because we do think of depression, anxiety, mental health as a medical illness. So if someone comes in to us to deal with high blood pressure, right, they might not want medication for that. And so what they're going to say a lot of times is, I'm going to change my diet, I'm going to exercise, and then hopefully I won't need those medications. And for some people, that will be enough. For others, as much as they change their diet, as much as they exercise, that blood pressure unfortunately may still remain elevated. And because there is a risk, right, with high blood pressure, there's a risk of stroke, there's a risk of other medical illnesses that can occur if we don't get the blood pressure under control. We then have to have a discussion about medications. It's the same with mental health. Yes, there are some people that say, I just need to talk to a therapist, I need to work through some things, and I will be okay. And a lot of times we say, let's try that first. And if we try that and it doesn't work, we're in the same situation where depression, for example, could be considered a life-threatening illness, right? A lot of people that have severe depression commit suicide. And so because of that, we have to treat this because, again, it is life-threatening in some cases.
You hit on something that I think is really important, particularly when we're talking about our young people, particularly in the urban community, PTSD. More and more young people are seeing and experiencing things that, for many of us, we may never experience in our lifetime. Having a loved one killed, seeing a body. Talk about that in the treatment and the necessity to watch out for our children because of the exposure that they have on many things, and again, particularly in the Black and brown community, in the urban areas.
Sure. So PTSD, post-traumatic stress disorder, is what we're talking about. And these are traumas that people experience in the past that they seem to be reliving over time. They feel that their life was in jeopardy, they felt threatened in a certain way, and then where does that go? And to your point, it can be related to traumas that they witness, it can be related to traumas that they experience. And so moving forward, what do we do about that? Again, there are some instances where we need to talk about therapy. How can we address this trauma so we can help you move forward with your life? And so that you can understand you are now safe, that this will not happen again, it's unlikely to happen again. But talking through that is extremely important. And there are a lot of groups that will focus on individual traumas that people have experienced, either through individual therapy or group therapy. But there is a need a lot of times to address that. So sometimes people will say, whatever that trauma was, I'm never going to speak about it again. And unfortunately, it can manifest itself in other ways in your day-to-day, relationships with other people, the jobs that you take, how you're speaking with others, how you're interacting with your community. And so again, going to therapy really does address things that have happened in the past. When we talk about mental health, we think about where we are right now in terms of, is there a diagnosis? Are we talking about depression, anxiety, schizophrenia? What are we talking about? But in addition to that, there are all these other components to who we are that also become very important to address. Our life story, what has happened to us throughout our lifetime to bring us here? Are there other behaviors that we have, drinking alcohol, using drugs, those sorts of things? And who are we at our core? What's our personality, right? If you're not someone who enjoys being social, then our job in mental health is not to make you a social person. It is to make it so that you're living the life that you want to live and not feeling that there are certain situations that are keeping you from reaching your potential that you see.
Where do people go for more help? What's you said having the candid conversations, I guess, with your primary care physician. Is that the baseline? And then we move toward seeking other help and perhaps getting a referral? Should we start there?
That's the baseline. I think that, and there's a couple of things if we take it back to the, minority community for a second. A lot of people say, look, I only want a doctor that looks like me, and I'm not willing to see everyone else. And depending on which specialty of medicine we're talking about, sometimes that's hard to do. For psychiatry and therapy, minority doctors make up a very small percentage of people that are able to provide care. And so for some instances, if you have a primary care doctor that you trust or there's someone that you trust, it's fine to start there. And they're very well versed in treating depression, anxiety, and many other mental health disorders. The issue becomes when we have something that's called treatment-resistant depression, where the treatments that I'm trying aren't working. Where what primary care doctors would usually do in terms of treating anxiety, when that's not getting better and we're talking about the need for additional medications, a lot of times then that's when they will refer you out to see a psychiatrist. But again, the OBGYNs, the family medicines, the internists, sometimes the cardiologists, sometimes oncologists, specialists, right? There are plenty of people that have other medical illnesses and become anxious. I'm having surgery. I've been diagnosed with cancer. What am I going to do? A lot of times that doctor that they already have a relationship with can get them started. And when it's not working, then they may be referred to a psychiatrist, for example.
Give us a couple of takeaways of what we need to know about mental health. And the other question is can anxiety lead to depression? Can depression lead to anxiety? Or can all of them kind of come together and just the grief and the anxiety and the depression, and then you find yourself just almost in a snowball situation where you're just running out of order?
Absolutely. So all of the above, right? A lot of times we are not sure. Sometimes people have depression and anxiety. And so a lot of times we will wonder which came first. Mm-hmm. If we treat one, will the other go away? And so we have to start to target what the biggest symptoms are, what the most troublesome symptoms are, and address that. A lot of times the medication, the treatment for depression and anxiety will fall under the same category. A lot of times antidepressant medications can treat both depression and anxiety. We're talking about selective serotonin reuptake inhibitors, SSRIs, SNRIs. Those are the medications we typically start with, and those will help with depression and with both depression and anxiety. But we really want to make sure that we're also addressing symptoms, right? So if someone comes in and they're not sleeping, we need to have a discussion about why that's happening. And maybe if we get you to sleep for a couple of nights, that anxiety goes down, because what really is fueling it is the fact that I'm not sleeping, or that I don't have an appetite, and so my brain's not really working that well because I haven't eaten. And so we need to really address the symptoms as well to figure out what exactly the best treatment is.
And the key is that this is treatable. It is not something that you have to live with, or you can live with it and function.
You can, and there is hope. I mean, there are many people that come in and they have said, I've been depressed for so many years. And a lot of times they respond to the first antidepressant that we try. Not everyone does, but we have a list of ways that we can get people better. We have to start somewhere. And a lot of times with antidepressants, it will take us a month or two to figure out at a good dose on the right medication, is this going to get someone better? But there is so much hope, and there's ways that we can treat. We have to do it systematically. I always tell patients, you're part of this treatment team. So I can't just kind of bark orders and get you better. I need to know exactly what you're experiencing. What are we trying to get better? What are we targeting? But there's hope. And again, we want people to know that there can be psychiatric emergencies. If you're having thoughts about hurting yourself, if you're having thoughts of suicide, that's when we want people to go to the emergency room, and they can get evaluations, and we can determine, do they need to come into the hospital for safety? Do they just need a referral to get started on medications or therapy? And so please, the bottom line is ask for help. There is help out there. There are suicide hotlines that you can call. But we're trying to get the message out that this is something that we want to continue the discussion on.
Yeah, and let's get the stigma out of the way.
Right. And so when people come forward, when people are talking to us about what's happening, when people are open and honest with their community about what has helped them, then more people are going to ask those questions.
Yeah. Where can people go for resources here? What do they need to access here?
So I think the biggest thing, so at Sibley, or are we talking about in general? Because here at Sibley, we have mental health specialists for anywhere from the emergency room to inpatient psychiatry. But in general, in this area, there are crisis hotlines. There are what we call crisis beds, where you can go if you feel that you are having a psychiatric emergency. And then we really want you to call your primary care doctor if you feel like you need to be seen urgently. Or you can go to your insurance provider if you have insurance, and they have agreements with certain psychiatrists that can see people on an urgent basis as well. In addition to that, there are treatment providers that are performing additional treatments. So again, we have what's called ECT or electroconvulsive therapy for people that have severe depression. We have transcranial magnetic stimulation, another treatment for depression. So we've talked a lot about medications, but there are other options as well. And so again, just finding someone that you can talk to and that can help guide you through this. I think a lot of times people feel like they're on an island, that they have to navigate this themselves. And there are many people that are willing to kind of hold your hand as we go through this.
All right. Dr. Erica Richards, Chair and Medical Director of the Department of Psychiatry and Behavioral Health here at Sibley Memorial Hospital. Thank you so much for joining us today for Let's Talk Health.
My pleasure. Thank you for having me.
All right. Once again, I'm Renee Nash. Again, this has been Let's Talk Health. Make sure you join us each and every week as we have candid conversations about our health. Again, we want to live our best health life. And in order to do that, we got to have the conversations. Be well.